letting me see you in your home today. I heard you had some questions and concerns following your recent surgery.
Hi, yes, I had hip replacement surgery 9 days ago, and there's bruising on my hip, knee, and elbow. I don't remember bumping into anything, but also when I brush my teeth, my gums are bleeding. So I don't really know what's going on. I'm worried that there's something wrong with my surgery, and I also was supposed to get blood work, but my daughter came in town, and I don't really want to go to the hospital or see any healthcare workers, but this is my daughter.
Aww. But do you have any past medical history that I should know about?
I do have COPD, and I use oxygen at night with the nasal cannula, but I did have the replacement surgery 9 days ago for my left hip, and I have AFib.
Okay, do you use, how many liters do you use of oxygen?
2.
Okay. And what meds are you taking right now?
I'm taking digoxin, 0.25 milligrams every day, warfarin, 0.15 micrograms every day, theopiline, 100 milligrams in the morning and night, vitamin C, Grimco, 160 milligrams morning and night, and I did complete my full course of cefazolin yesterday.
Okay, how many milligrams of vitamin C do you take every day?
I take 900.
Okay. Do you know why you're taking the ginkgo and the cefazolin?
Well, my daughter told me that I should take the Grimco to help with my memory, and the cefazolin was prescribed by my surgeon. She said that it's for infection. But I also do have my Grimco here with me if you wanted to look at it.
Perfect, thank you. Perfect. Now I'm just gonna get a set of vitals and listen to your heart and lungs, and then we can go over your medications to see if maybe one of those are causing you some issues.
Okay.
Okay, now I'm just gonna check your pulse. Can I just see both hands? Thank you. Listen to your heart. Now I'm gonna listen to your lungs. Take a deep breath. Another one.
So do you know why I'm taking all these meds?
Yeah, we can go over them all. So digoxin is for your AFib. This drug works to help decrease your heart rate, but also helps your heart have a better and deeper contraction to get the blood moving around your body. While taking this drug, you need to monitor for toxicity. Some symptoms of this would be low heart rate, blurred vision, and you might see some white, green, or yellow like halos. You also have to monitor your apical pulse. You have to monitor this for 60 seconds, and if your pulse is below 60 beats per minute, you don't want to take the medication.
Oh, I didn't know I had to do that. Where's my apical pulse?
Yeah, I can show you. Okay, so your apical pulse would be right about here, so you're just going to take your fingers and feel it.
Oh, I feel it.
And count for 60 seconds.
Okay.
I also encourage you to follow up with your blood work, because if you have low potassium level, it can cause you increased side effects of digoxin, like very low heart rate and dizziness.
Oh, okay. I'll be sure to make sure I make an appointment.
All right, and then the next one you're taking is the ginkgo. So I know that you said that your daughter wants you to take this because it helps with your memory, and it does this by increasing the blood flow to your brain. You're also taking warfarin, which is an anticoagulant. This helps stop the factors in your blood that make it clot. You're on this for AFib. It helps to prevent the clots that could form, because in AFib there's not good blood flow, and blood just sits in the atria, and when it sits it can clot. So you will need to monitor your lab values, PT and INR, to make sure that you do not have too much of the medication in your system, which can cause you to bleed, or if you have too little of the med in your system, it could cause you to still have clots. Also, vitamin K, things like spinach and kale, can decrease the effectiveness of this drug. So try to stay as consistent with these foods. So like don't increase or decrease the amounts that you normally would eat. And while on this drug, you have to look out for bleeding. You might see easy bruising, black tarry stool, and blood in your urine.
Oh, so is this why I'm bruising so much and my gums are bleeding when I brush my teeth?
So warfarin can play a role in this, but when using ginkgo and warfarin together, it can be a dangerous situation. It can cause these drugs to increase your risk of bleeding, and you might not be aware of it. Alternative things you could do to increase your memory and help with that would be doing things like crossword puzzles or even just puzzles.
Okay, so I should stop taking it then?
Yes, I would advise you to stop taking ginkgo. And then you're on theophylline, which helps to relax the smooth muscles in your lungs to help open them up and let you breathe better. It's used to help treat your COPD. It's also a drug that speeds up the heart. It has almost like a caffeine-like effect, kind of makes you feel jittery. So some of the symptoms you might have are dysrhythmias, nervousness, dizziness, hypotension, and high heart rate.
So if digoxin lowers my heart rate and this one raises it, shouldn't I be concerned of any negative side effects?
So theophylline can cause interactions with digoxin. It can increase the digoxin effect and lead to toxicity. So we want you to watch out for things like low heart rate, or if you're feeling dizzy and like you're gonna pass out. And if you do feel these things, we want you to call us and let us know.
Okay, I'll make sure that I look out for signs and symptoms and call you guys for anything.
Okay. And then you're also taking vitamin C. This can help promote wound healing. And then cefalozolin, like you said, is the antibiotic that your surgeon prescribed to help prevent the infection after surgery. And you said you finished your course of antibiotics yesterday, right?
Yes, yesterday I finished.
Perfect. So going forward, you should stop taking the ginkgo and contact your healthcare provider before starting any new supplements so that we can let you know of any interactions. Do you have any questions for me?
I don't think so. Thank you for coming.